everyone, this is scapula. It is bone of upper limb and it is also known as shoulder blade. It is thin bone. Let us look at the location of the scapula. Scapula is located on the posterior lateral aspect of the thoracic cage. For the site determination of the scapula, we will see three points. First point is the lateral or glenoid angle is located laterally. The acute inferior angle is downwards and the dorsal surface of the scapula has spinous process which determine the dorsal surface of the scapula. Hence, we conclude that this scapula is of right side. Now let us look at the features of the scapula. Scapula has two surfaces, three angles, three borders and three processes. Now let us look at this features in detail. First we will look at the surfaces. This is dorsal surface and this is costal surface. Costal surface has three longitudinal ridges which adjoins the thick border of lateral border. Now we will look at the dorsal surface. Dorsal surface is divided into two parts by the spinous process. First, supraspinatus fossa and infraspinatus fossa. Supraspinatus fossa is smaller than infraspinatus fossa. Now, let us look at the details of borders. This is superior border. It is shortest and it contains suprascapular notch. Then this is lateral border. It is thick and contains infraglenoid tubercle. This is medial border. It is thin. Now, let us look at the angles of the scapula. This is glenoid angle or lateral angle. This is inferior angle and this is superior angle. First, lateral or glenoid angle. It has infraglenoid tubercle and supraglenoid tubercle. Then it attaches with the head of the humerus to form shoulder joint. Then there is inferior angle which is directed downwards and superior angle which is at the junction of superior and medial border of the scapula. Now let us look at the processes of the scapula. Now, the processes of the scapula. First process is spinous process. It is a triangular plate and it has three borders: anterior border, lateral border and posterior border. Posterior border further has upper lip and lower lip. Posterior border is known as crest of the spine. The spinous process of the scapula divides the dorsal surface into two parts, supraspinatus fossa and infraspinatus fossa. Then, second is coracoid process. This is coracoid process. Coracoid process is slightly laterally located and it is band finger-like structure. It has two surfaces and two borders: medial border, lateral border and superior surface and inferior surface. Then, third process is acromion process. Acromion process is an expanded plate-like structure. It is continuous of spinous process and it has two surfaces and two borders: superior surface, inferior surface, medial border and lateral border. Now, let us continue with the attachments of the scapula. First, we will look at the origins. First muscle is subscapularis muscle which originate from subscapular fossa from its medial two-third. Then there is supraspinatus muscle, origin from supraspinatus fossa. Then there is infraspinatus muscle which origin from the infraspinatus fossa. Then from the superior border, suprascapular notch, the muscle origin is inferior belly of omohyoid. Then from the on lateral border there is presence of infraglenoid tubercle which gives origin to the long head of triceps brachii. Then from the superior supraglenoid tubercle it gives origin to the long head of biceps brachii. Then there is origin of teres minor and teres major on the lateral border dorsal aspect. Teres minor arises from two slips and in between the two slips there is circumflex humeral artery. Then on the lower two-third of the lateral border dorsal aspect muscle origin teres major. Then let us finish dorsal origin is from inferior angle, and another muscle origin is deltoid, with which origin from the lower border of the crest of the spine, which continue to the lateral border of the acromion process. So this whole give origin to the deltoid muscle. Then another origin is short head of biceps brachii and coracobrachialis, which origin from the coracoid process. From medial on a part of the tip of the coracoid process, it gives origin to the coracobrachialis muscle, and from lateral part of the tip of the coracoid process, it gives origin to the short head of biceps brachii. Now we will look at the insertion of the muscles. Then there is insertion of levator scapulae, rhomboid minor and rhomboid major from the medial border dorsal aspect. Levator scapula is inserted into this part from superior angle to the root of the spine, and rhomboid minor is inserted to the opposite of the root of the spine, and rhomboid major is inserted into from root of the spine to the inferior angle from like this. And then there is insertion of serratus anterior on medial border on costal aspect. It gives insertion in digitations. One digitation is from superior angle to the root of the spine, then 2 digitations to the medial border, and 5 digitations are from the inferior angle. Then another insertion is trapezius. Trapezius is inserted into upper border of the crest of the spine, which continue with the medial border of the acromion process. So this whole is the insertion of trapezius muscle. Then there is insertion of pectoralis minor muscle on the coracoid process. On superior surface on medial aspect of coracoid process, it gives insertion to the pectoralis minor. The attachments of the scapula are over. Now we will look at the clinical anatomy of scapula. First clinical anatomy of scapula is paralysis of serratus anterior muscle, which was inserted into costal aspect of the medial border. It causes winging of scapula, and nerve affected in this is nerve to serratus anterior. The arm cannot be abducted beyond 90 degrees. The second clinical anatomy of scapula is scaphoid scapula, which occur due to fall on the arm. Thank you.